Welcome to the launch of the Personalised Health Index, part of the FutureProofing Healthcare initiative. The index is a really unique resource. It gives an overview of the current status of the health systems of 34 countries across Europe. And we're going to be hearing from a panel of public health experts who are going to give their views on the index, but also we're going to share some of the successes and challenges in advancing personalised healthcare in Europe. And we want to hear your views and your questions too. And you'll see that in the top of your screen, there is a question mark icon. And we'd like you to submit questions from now. Please say who you would like to answer the question, and you can make them as challenging as you would like. And of course, please do tweet using the hashtag FutureProof Europe and hashtag FutureHealthLive. Now, personalised health is a concept, and concepts, I think, can always improve by being visualised. So we have today a cartoonist who is going to help us in that process. He is Floris Outshorn. I've worked with him before, and he is excellent at translating concepts into clear and witty cartoons. And if you don't believe me, let me introduce Floris. Hello, Floris, and I think that you've already been inspired, and perhaps you could share with us your first cartoon.
Hello, Claire. Yes, here it is. Obviously, today we're trying to move away from the Stone Age and be future-proofing ourselves.
Yes, indeed. It's all about moving forward and advancing. Thank you, Floris. And I'm going to move forward now because we'll come back to you shortly. And I'm going to introduce somebody who's been really involved in the index and also with the FutureProofing Healthcare initiative. That person is the head of Pharma International at Roche. Let me please give the floor to Porrick Ward.
Thank you, Claire, and good morning. Thank you, Claire. Good morning. On behalf of Roche, I'd like to add my welcome to everyone to the launch of this Personalised Health Index for Europe. This is a pivotal time for healthcare across the world, but only in Europe coincide with a unique opportunity to rebuild the policy framework for health across a whole continent. Now is exactly the right time to be ambitious about the future of healthcare of Europe and about the future of Europe in the world. The findings of the index tell us that there are shining beacons of best practice, of ambition and innovation right across Europe. To succeed, we must pull together as a force for progress and innovation in the world. Over the coming months, policymakers in Brussels and in every country across Europe will take decisions that could shape the future in so many ways, from the survival hopes of someone diagnosed with lung cancer in 10 years' time, to how we manage the next global health crisis, all the way through to whether Europe can maintain its place as a global leader in medical science. Initiatives like the European Green Deal, the EU for Health programme, Europe's Beating Cancer Plan, a new data strategy, and indeed the new pharma strategy will shape the future of healthcare and the future of health of Europeans for generations to come. The difficult truth is that the pandemic could set back health outcomes and hit economic growth for years to come. If we're to make health systems truly sustainable for the future, though, I believe we must accelerate, not postpone, making healthcare more digital, more connected, and more personalized. These changes can and they must also make healthcare and healthcare systems across Europe more sustainable. Right now, across Europe, we can make the changes that could not only create healthier populations, but also drive fairer access and lower society. That means bold changes are needed to our regulatory system and to our health data rules to unlock a new era of digital health. For our part at Roche, we're committed not only to continuing to invest in research and development, but also to convene experts, physicians, governments, patients, and the pressure, not just to talk about the future of healthcare, but to create real, tangible actions and solutions. The fact is, we must recognize that the challenges, opportunities facing us are simply too big for company or even one country to tackle alone. That's why, as proud supporters of this index, Roche chose to help to bring together a group of experts drawn from right across the healthcare spectrum: patient representatives, academics, doctors, policymakers, ethicists, and many others. My sincere thanks to the panel of future-proofing healthcare experts from around Europe. You've created a resource that's now available to the European healthcare community, and that will provide the insights we all need to track progress towards a better, healthier future. Thanks again to everyone for joining us today. We invite this whole community to continue to remain connected and to work together so that future generations might say that 2020 was the year when the next revolution in healthcare in Europe started. Thank you.
Thank you very much, Pádraig. And indeed, let's hope that 2020 is remembered for some good things as well as some of the less good things that we're all experiencing. Thank you very much. Pádraig was mentioning the index, and the index has been carefully collated, as Pádraig was saying, and analysed. And it has 20 measures which are split into 4 categories called vital signs. So let's visualise this. And Floris, could you show us how you visualised these vital signs for us?
Yes, Claire. As you can see, there are 4 pillars. They're built up of blocks, and the blocks provide information to the different columns. The columns can then be translated into an index, and the index can be translated into a heat map, as illustrated by that little burning notion over here. They can dictate measures like, the much maligned mouth masks, or medication, or regulation, other policies, and also provide insights for medical personnel and other people involved.
So thank you, Floris, very much for sharing. You see how wonderful it is when you can visualize something. And that is a very good graphic illustration. I was wondering, Floris, with your cartoonist hat on, whether you've been able to get inspired and perhaps make us smile. If you've got a cartoon that you could show us already, that would be fantastic.
Sure. Well, we've been talking about better use of resources, obviously. Oh, sorry, I lost my feet there. How's this? Hello?
Yeah. Right. I don't know whether you caught that cartoon, but what I could see was that there was a joke about coughing and data sharing, which makes us think indeed the importance of track and trace programs and data sharing at this difficult time. Let's go back to Floris later on. He can re-show us that cartoon because I only glanced at it quickly, but I think it's an example of how you can visualize these concepts and also make us smile. So I talked about the panel of experts before. Let me introduce you to them. We have a clinician, we have a national policy maker, and we have a European policy maker. First of all, the clinician is Professor Stjepko Pleština, who's one of Croatia's leading oncology experts. He specializes in developing innovative drug applications and also health management of systems, health system management. And he is the head of the oncology unit of the University Hospital Center in Zagreb. Welcome, Professor. We also have Päivi Sillanaukee, who sits on the executive board of the WHO, and she represents Finland. And Päivi is currently the ambassador for health and well-being at the Ministry of Foreign Affairs in Finland. It's a new pilot program of cross-sectorial cooperation. Welcome, Päivi. And also Ceri Thompson. Ceri Thompson is a public health expert who works at the European Commission in Brussels, and she has worked for DG Sante, Eurostat, and she's now Deputy Head of Unit for e-health, well-being and aging at DG Connect. So welcome, Ceri. So let's start with a quick fire round. So perhaps less than a minute, just to tell us how useful do you think this index might be in your work? Stjepko, if I could have your thoughts to start off this round. If you were able to unmute yourself, that would be fantastic.
I'm awfully sorry. Can you hear me now? So it's always good to be able to compare with others, and the Personalized Health Index gives a unique overview of our current status of 34 European health systems when it comes to realizing personalized healthcare. The index enables countries and regional comparisons which can be particularly valuable for smaller countries such as Croatia, very small country with about 4 million of inhabitants, and it allows us to identify best practices elsewhere that can accelerate progress towards personalized healthcare. I was very pleased to see that recent improvements in Croatia in oncology have been noticed and reflected in the index, particularly under the vital sign health services, where Croatia's performance is partially driven by a high score on the measured genomic testing. I'm optimistic that our score will be even stronger in future iterations, as the recent improvements we have been working on will be better reflected.
Thank you very much, Professor. Indeed, and one of the aims of this index is exactly to exchange best practice. Päivi, in your field, how do you think you might be able to apply some of the information and knowledge and insights that you get from this index? No, this is always the issue in this lovely virtual world.
Okay, data is fuel for personalized medicine, but also for exchange of views. And I think that this is a very strong to start a dialogue across countries and inside Europe. And that, I think, it's very important for me, but also for other countries and politicians in the countries, that they see their position and also can begin to change the views and then experiences and try to get better. So thank you, Ross.
Yeah, absolutely. It's about exchange of data, learning from each other, and yes, constant improvement. Thank you. Ceri, how useful do you find this index in your policy work?
Yes, thank you. I think we'll find it very useful. I think it's very timely. As I said earlier, we are at a very key moment in the digital transformation of health and care, and we've seen how the policy and the investment and frameworks for digital health is really strengthening in recent years across the EU, and we're going to continue to see that. This index is going to be a useful tool to help shed some light on our understanding as to where we are in the EU, where different countries are, and this will be very valuable as we look in terms of investments coming up. And I like the fact, very multidimensional, that it's recognizing it's not just about the IT investments and the IT aspects, it's about the policy frameworks, the leadership. And And in that sense, it complements very well also how we see this topic. Of course, and it will complement indeed a current survey that we have ongoing with member states, which is really asking them to tell us how from the government's perspective where they feel they are on various metrics in relation to e-health data sharing and interoperability. We hope we'll have results of that soon in the autumn. So these two tools can sit alongside each other, and I think, as Päivi said, as this one, they are excellent tools to start a conversation where it needs to happen. They're expressing these complex topics in a simple way, and they can communicate very well and help raise awareness among the important groups. And so we are having many such conversations with a number of different kinds of stakeholders. And so I think this will be a valuable tool to bring into those discussions.
Thank you, Ceri. Well, let's start our conversation and dig a little deeper and find out more about what you're doing in your areas to advance personalised health. Stjepko, Croatia has relatively high incidence of cancer and mortality rates. How do you see personalised health actually managing to reduce mortality?
So it's very well known that incidence of malignancies is higher in a northern and western part of Europe, but on the contrary, mortality is higher on the east and the south part of Europe. So in Croatia, the trend of cancer mortality is still higher than expected according to the rate of cancer incidence. Actually, the data suggests that for every 5 newly discovered and newly diagnosed patients, 3 of them will die from cancer, a ratio in which we are significantly behind more developed European countries, but also some countries in our environment. So with very high cancer mortality rates, which are observed in Croatia and the broader Central European and Southeast European region, for some types of cancer, for instance, the colorectal cancer, Croatia has the second highest mortality after Hungary. That is why we initiated the Personalized Medicine in Oncology project. So with aims to improve care for cancer patients by using genetic profiling to ensure then targeted therapy, improve the quality of life, and finally treatment outcomes and reduce mortality. So as cancer treatments improve, many cancer patients do not have just one disease or one outcome anymore. And one treatment may not be appropriate for every patient. That means we need to know the genetic and molecular characteristics of each tumor and understand the various stages of the disease to improve diagnosis and treatment, decrease mortality, and improve patient outcomes. As a result of the Personalized Medicine in Oncology project, Croatia is, as I know, actually a leading country in the region and Europe for precision oncology, with freely, completely available genomic testing of tumors in patients with metastatic disease, completely covered by our health insurance system, and a focus of individualized treatments based then on genomic profiling. We hope that will result in lower mortality rates in the future.
Thank you very, very much, Stjepko. And indeed, on the vital signs on health services, yes, as you say, you are doing well with being very strong on access to genomic testing. Let's move to Finland. Country of Nokia, so a technologically advanced country. You do very well overall in the index. Can you explain to us a little bit more, Päivi, about why Finland is doing so well?
Okay, there are several reasons, and one is that we have data available. We have been collecting for decades data from our population to be able to serve them better, and so that people are used then to use digital public services. And then so we have digital infrastructure also, so that technical infrastructure then country-wide. Then there is capability and knowledge to use the digital solutions, and that is also a very important thing. We have legislation and regulation framework, which we have been improving all the time and trying to get it more updated to the new era. And here we have we are advancing, and we just this year, in the beginning of this year, we started then the secondary use of the data legislation, or actually we have had that 1 year now in action. And that means that that we have secure processes, and then also one-stop shop organization then who can serve academic world, but private sector, but also then public sector with the information and we have and the data we have in our registers. So there is a way in legislation described how then in the secure way to combine the information anonymously so that it is also be able to use for the secondary use, not only the primary use of the data. Then also there is willingness from our people. They are very eager to use new solutions, and one example I can tell you here is that when we launched in the beginning of the September then the track tracing application, which before we launched it, we had a public open public discussion, and we did legislation so that people could be sure that their data is used very securely, and we respect their privacy. So in 2 weeks then over 40% of our population has downloaded the app, and the number is increasing. I think that that is world record. So it shows that people are willing also to use these applications. And last but not least, we have very lively startup society.
So indeed, there's many factors there, from data literacy, data trust, good infrastructure. Thank you, Päivi, for giving us that overview. Ceri, we heard from Porrick at the beginning that there are a number of initiatives at European level to drive forward personalised health. Perhaps you could give us a brief overview of some of the key ones that are doing that and that you're involved with.
Yeah, sure. So we're working very closely with the member states on these topics, and indeed more broadly really on developing the digital transformation of health and care and creating improving the picture of health data and its use in Europe. And of course we've seen the COVID pandemic, which has given us very concrete examples of just how useful developing the data picture will be, whether it's for personalized medicines, but not just for personalized, but for wider usage as well. If we had this data available, because we've seen how it's been used to speed up the production of vaccines, how it's been analyzed to identify, using high performance computing to identify drugs that can be repurposed as a treatment for COVID. And we've seen across the EU the great rise in things like telemedicine services, as these have enabled vulnerable patients to keep in contact with their clinicians remotely from the safety of their homes. So we put the big framework on our side for this work is set by the European Strategy for Data in February, and this sets out the broad lines really for developing the data picture in Europe per se, and encouraging the reuse of data that can really underpin a successful digital single market. And of course a key part of that is the health, and the health part is very specific given the sensitivity of the health data. And the Commission now has a goal to create a European health data space and to make the data available. As Finland has, Päivi mentioned, Finland has a lot of data available, but to bring this exercise of making the data available on an EU scale, and the data strategy describes what will be needed in terms of, for example, the investments in infrastructures that the EU will need to deploy at the various levels to put in place the secure data sharing, including across border. And it's also very much putting in place and driving forward the need for the appropriate governance for how this data sharing will be managed. Of course, this is critical for health data, given its sensitivity, and it can't be overstated the way in which it's important, because clearly citizens must trust the way in which their health data is being used and shared, or they will decline to participate, and they'll decline to make their data available. And on this governance, as Päivi mentioned earlier, we're aware that some countries such as Finland and also France are taking good strides in the direction to create governance infrastructures and frameworks, and we need now to see other countries put in place their own arrangements. And maybe I should say at this point, for the health sector, our goals are about developing a citizen's ability to access and share their own data with themselves or with their clinicians, and to keep some control over their data. But it's also about developing the big data for research and innovation, for example, as you mentioned, personalized medicine, and encouraging the use of digital tools and services and their integration into health and care systems. And so, for example, on the data picture side, and supporting a little bit what our colleague from Croatia has just mentioned, so developing the data sets, and we're working, for example, very closely with member states, a number of member states, under a political declaration that I think up to 22 member states have signed now, called the 1+ Million Genome Initiative, and it's about seeing genomics data made securely accessible to research and innovators, as well as for primary care uses, primary uses across the EU, and to make 1 million genomes securely accessible across the EU by 2022. We're also working with other kinds of health data, cancer images, for example, electronic health records, patient registries, disease registries, and a number of initiatives to see the trusted data sets developed, to deploy the infrastructures, and to put in place the governance arrangements. And this is obviously a big task, and we're at the relatively early stage of it.
Thank you, Ceri. As has been mentioned, the index is about starting a conversation and an exchange. So I wonder, Stjepko, whether you would like to react to anything that you've just heard from Päivi or from Ceri. And if you were able to unmute yourself.
Again, sorry. From the beginning of this year, Oncology Society slowly started with genome profiling of cancer patients, and during this process we realized that we need to do more through discussions. How can we implement it? So that means to define the proper approach with which tumor types to test, in which stage of patient's disease, and also a very important thing, to organize the clinical decision process and establish the molecular tumor boards. Additionally, more education about genome profiling and personalized healthcare in general is needed from broader oncology audience, not only in Croatia, but in whole Europe. So then we can reach and talk about the better results in our cancer patients. So, I mean, the better education is needed about the personalized healthcare.
Thank you, Professor Päivi. Would you like to pick up on anything that you've heard from Stjepko and Ceri?
Yeah, I would like to pick up the importance of countries to try to find the way and interoperability of our technical infrastructure, but also how the data could flow then over the borders and across the borders. And we have seen again during this pandemic, COVID-19, that there really is need to see and have the data also across the borders. And I was pleased also to hear from Ceri that you mentioned the Million Genomes pillar. I would say that is one important pillar in the European health data space. And countries, not only EU countries, but there are also Norway and UK, which still is part of EU, and some other countries also, which are then cooperating under that project. I see it very important that we have this kind of collaboration together, and Million Genomes will then give us concrete examples how we could then share and use very sensitive data, and we can also then together and learn from each other. And Finland is doing here again some advanced legislation. We are preparing our genome law proposal to our parliament, and this will be perhaps presented to the parliament from the government next spring. So I think this is really up to date issue also, so that we could then have a showcase inside Europe then that how could this kind of sensitive data be then handled in a secure way. And Finland is leading 3 out of 11 groups then and teams under the initiative of Million Genomes. And we are also working very closely with EU, with more broadly on sustainable data sharing. So I think it's very important that we try to find out a common space for this use, for Europe to be very number one then, to show a very good ecosystem for companies and academy and public sector to work together and develop that kind of solutions which are which really respect privacy. So this I would like to take up here.
Yeah, absolutely. So we can see it's this balance between sharing data for, positive health patient outcomes and also privacy, and particularly genomic data is particularly sensitive. You've mentioned some of the challenges. Päivi, although Finland was doing very well in this index, I think, and I'm just having a look here, that on one of those vital signs, I think you rank 11th, and that was on the Health Products and Technologies Vital Sign, which evaluates devices and applications and platforms. I mean, does that come as a surprise to you that you were not doing so well in that one?
Yes, a little bit, but then I understand it, because one big challenge for us, but also for other countries, is that we have a lot of solutions and devices available, but the implementation is a big challenge. How we could then get all the solutions we already have implemented in our health systems, and there we really should do better, both Finland and also the other countries. And here we again come to the regulation and legislation framework for companies, and especially for startups, small companies. If every country has a different kind of environment where these solutions and devices can be implemented, it's very hard then, and it lowers then the possibility for us to get all the potential out of the new innovations we already have.
Common European space that Ceri was mentioning. If we just focus on a few challenges, and then I'm going to go to the audience to see what some of their questions might be to you. Stjepko, you were mentioning, of course, access to genomic testing, where you're strong in Croatia. But I was wondering, do you have challenges in actually using the data in your healthcare system?
Of course, we do have. So the biggest challenge is in Croatia is the lack of patient registries and databases. So we are not able to track patients' clinical outcome and to compare one hospital with another, and to have a solid basis on a starting point for identifying gaps and finding solutions. So the As a clinician, I think that data should be a basis for informed decision making. When you do not have data, finding the best solution for the patients is very difficult. In Croatia, while we do have cancer registries and epidemiological data for decades, to truly personalize treatments, we need to go one step further. We need to be able to monitor and track how patients are responding to a treatment in real time, and not just guide our decisions based on information from randomized clinical trials, which are done in a controlled setting, but phase 3 prospective randomized trials are very slow and expensive. So to address this challenge, we are building a new database which will combine genomic profiles with clinical data for each patient. And by combining these two data sources, then we can improve cancer outcomes in Croatia further and better exploit the full potential of the information that we now have through continuous collection of clinical data and better disease monitoring. Once again, Croatia is a very small country, and we also need data from bigger countries, especially for hard to treat cancers with low incidence or those cancers with small patient population. Sharing health data across borders is crucial, not only for us, but I think for whole Europe. So I would welcome more support and guidance for the European Commission in this regard.
Well, thank you, Stjepko, and perhaps that leads me nicely on to Ceri to respond on what Professor has just said, because indeed what we can see in this index is that there are disparities. Finland, Germany, Sweden do well, and I'm wondering, with some of the initiatives that you've outlined, how can you try and bridge that gap, bridge the digital divide?
Yes, I think. Looking at the index, we see scores for each country, and we see a mean, an average, and I think what will be interesting over time is not only to see, for example, the average value increase, but particularly important because it's a range of different countries. It's to see those countries that are lower performing move upwards and towards that mean. And well, we of course there are disparities. I think to a certain extent, we know that this is to do with the fact that countries are at very different starting points in terms of where they are in the digital transformation. They've got different amounts of data digitized. They've got different resource levels. They have different governance within their health systems in terms of supporting their health systems through change. They've got some are regionalized, some are very centralized. They've got very different inherited characteristics and cultures. So, I think we have to accept that countries will go at different speeds. But the key aspect for us is at the European level is about creating the framework so that countries will move to in the same direction. And also then it's about, I think, wise and sensible investments. And we're at this point in Europe, we're at the beginning of a new spending program where there are many new programs that are going to have resources available for digital. And that'll mean, to a certain extent, digital. Well, there is the Recovery and Resilience Fund that is a new way of using funds in the EU, for which 20% of these funds are earmarked for digital generally, of which, of course, then countries can make the decision about how much they want to move towards health. We have the new Digital Europe program, which will be investing, more than 8 billion in digital across AI, across cybersecurity, across digital skills. And countries, we need to work with countries to make sure that that money is going where they particularly need it, according to the profile of their country, which the index, of course, is helping to illuminate. We also have a new EU for Health program, that will support, sort of give seed money to help with the work around new kinds of perhaps capacity building. And there are regional funds as well, where we will encourage member states to invest, to see them develop their capacity across their health and care systems to store and process data and to digitize data, and to a system is created where the citizen can access. So I think that's what we do in the EU is to provide the frameworks and to really work with member states on the basis of as much data as possible. And of course, here the index is so valuable, to try and support member states to really see this new wave of investment that will launch in 2021 and under the spending program, to see it directed where it needs to go in different countries, and then to develop to ensure that, as I said, we have the common frameworks and countries are moving in the same direction.
Thank you, Ceri, very much for that. I would like to go to the audience. I have to say, on my screen, I'm not seeing any questions from the audience at the moment. Now, I don't know whether that is my technical error or whether there are questions from the audience. So please, could the director just tell me in my headphone, are the questions from the audience and what are they? Because I would like to go to the audience, even though I'm not seeing any questions come in on my screen. So let me just see whether that's going to. Thank you. We're just checking, because I think it's very important that we do hear from the audience. And in the meantime, just while I'm getting some clarification, Ceri, I was wondering about this. What you might be doing to encourage healthcare professionals to make this transition to digital health systems. Are there any particular projects that you're working on in that?
Yes, I mean, here again, it's about supporting the member states to ensure that they have the right skills in their health and care systems. I mean, we talk about the need for the interoperability of data, and the interoperability of data in the health and care is not just about the IT and how the data is structured, although of course these are critical and we need to invest in them, but can the data be used when it gets to the other end? So if you've been able to access data or securely share your data with a clinician, perhaps you're seeking a second opinion in another country, when can the clinicians or the receivers of this information, whether it's pharmacists, whether it's the nursing staff, can they understand and act upon it? And of course, this means skills. And then not only in terms of the interpretation of the data and they're using it, but it also, in terms of the work to, for example, use the data, apply AI tools on it within a clinical setting, develop the decision-making support tools and these kinds of, and really use the data alongside the digital tools. All this, of course, requires investment in skills. And this is why, certainly for programs such as the Digital Europe program, investment in skills is a key tranche of the money that we intend to make available to member states, as I think the case for the EU for Health will also have an emphasis on skills. And the idea, I think, will be to, for example, because this is European funds, and of course there are also member state funds, would be to create, for example, framework conditions, or what can we do with the EU to support these programs? Can we create sort of joint curricula? Can we encourage a certain framework for the skills to develop? But it's about sort of providing support along European lines to the member states, and the member states as well, responsible as they are, and being key actors in the management and running of their health and care systems, will be closer to their own picture, closer to their human resources working in this field, and we'll work with them to see how we can align the funds at our level and the funds at their level for this purpose.
Ceri, thank you. We have got a question coming in, and I'm sorry, Ceri, it seemed to be one for you, but Päivi and Stjepko, please step in if you would like. And it is it realistic to expect countries with established health systems and infrastructure to adopt widespread data sharing, Or is this only feasible for countries with newer, less established health systems? And the person is saying, so Estonia, obviously a new established health system, versus UK. Ceri, if your thoughts on that would be great.
I think it's in all countries' interests to develop to support the development of and, for example, common technical specifications. I mean, talking about interoperability again, if we want to create the possibility to securely access different kinds of health data across borders, this means, for example, that we need to develop in a consensus building way common technical specifications and then see these taken up in countries. And clearly, I think this is a benefit to all countries. All countries will have will be able to use this data along with the common resources such as high performance computing, and will have stakeholders in their organizations, clinicians. They will have their own citizens who are traveling across the EU. They will have stakeholders engaged in the innovation process, and so there'll be a benefit to them to be able to participate in a European health data space in this way. So I think sometimes for the more developed countries who've already established their own ways of working, it will be, there's a greater cost perhaps in then moving towards a consensus technical specifications. But also these countries are leaders in terms of how these technical specifications get shaped in the first place, because they've already done the work internally in their own systems to see, what works well. So it's a different picture. It's true that for a country that is at an earlier phase in the path, that it'll be easier to, for example, to accept a consensusly derived technical specification and bring it on board, and that those countries that are more advanced, it's a different kind of issue to tackle. But indeed, I think
thank you, Ceri.
Sorry, go ahead.
No, thank you very much. I'm delighted. The questions are now flowing in for everybody. We've got a question, Stjepko, for you, which says, what are the current barriers for combining genomic profiling with clinical data for each patient? Is data interoperability is data interoperability a challenge in Croatia? So 2 questions there for you, Stjepko.
There are indeed a lot of challenges for us as oncology professionals, but also for the healthcare administration. Of course, that there is always a lack of resources as the reason. But I would say that there are many reasons which are beyond that. So, however, during the time when the government is struggling with COVID-19 pandemic, focus on oncology and personalized healthcare is very low. So, first of all, our challenge as oncologists is to make oncology important again, to put oncology patient in the center of each and every healthcare action and improvement. So, Croatian government should come back to normal, non-COVID patients and help us to improve results. To share data among European countries, I think it's conditio sine qua non, because also we share published data from clinical studies. Why not to share data from real clinical life?
Much for that answer. Let me direct a question to Päivi. How can ensuring secondary use of data, which you've been talking about, the legislation that you have, help government make stronger healthcare decisions? What have been the learnings in Finland?
Thank you. The learnings have been when we have now had 1 year that legislation in action, very positive. Of course, it is easier then for researchers and also for government and those who steer then the health system and are managers there. It's easier for them to have the data and be able to have a data-based decision making. And also, the access is easier, but then it also has enhanced the update of information. While we have 100% interoperable patient healthcare, electronic patient healthcare records, so it's really important that they are 100% interoperable, so that when we have then the patient data updated, then so that it then goes towards the real world data, it really gives us then possibility to better also steer our health system, and that has helped us during the COVID-19 crisis also. But we need the development and research and innovations to happen then. And that's why the ecosystem is also important, and we need the organization which then takes care of a secure way and smooth processes then to handle the data, to take the data from different registers to those who innovate and develop. But then we also need to concentrate more now onto our social and health service system, so that all the innovations could be very easily then tested there, so that our social and health service system could be then test-based. And we have here some work to do. I have to mention here that we are going through a social and health service reform now, which the politicians have tried to do then for a decade, and now we are very clear to get the target there. So after that, it will be then also easier to concentrate on, to build on the digital systems and services there. And I would like to then not only say that we have a personalized healthcare, I would say that we are then aiming to have personalized social and health services. So not only medicine or care, but we have to adjust more the actions, social services, support to people, and then their incentive to change their lifestyles. I think that we have here already very good solutions and innovations to be able to do that. So we are really not concentrating only to the personalized healthcare, but personalized social and health services. And here we have the possibility when we have this legislation for secondary use of the data in action. Thank you.
Thank you, Päivi. Now, there's the question to all three panelists, and so I will just ask you to raise your hand if any of you feel you could answer this one. This is from a gentleman in the Department of Health in Tasmania, Australia, who says, can the panelists comment on incorporating the Gross National Happiness Index into the European Health Index? Päivi.
Thank you. Of course, I have to then comment this because Finland is the most happiest country in the world, according to that index then, and have been for some years now. And I think that one reason is that we have a whole of society approach here. As I mentioned that we have quite a good infrastructure according to data, but also the digital system. But being a Scandinavian welfare society where people have had equal possibility, of course they pay taxes, but then we get free schooling, also university education is free for us. We have universal health services here, and the public services, then when it is taxation based, then also the government and municipalities have very strong incentive to get the system effective and then get also most out of the new technology. So I think that the infrastructure we have here, it gives then also advantage to try to use the new solutions, digital solutions. And when we have a very high educational level in our country, so it also gives us know-how and skills then to use, but also to innovate. So here are, I think, some of reasons. although we live in north, very north, and now we are heading towards winter and very dark time. So I think that the way of how the society then and how our country then serves people is one reason, but also a big incentive.
Thank you very much, Päivi, and indeed for the authors of the report. They may, when they next do an updated version, want to look at this. And indeed, somebody is also asking how frequently will it be updated and are there targets for each country? And I think that's best addressed to the authors of the report, and we'll get back to you on that one. Ceri, there's a question for you, which I think is, of course, really important, which is how is the Commission taking into account the voice of the patients in shaping the new healthcare systems across Europe? And what do you believe could be the role of patient organisations in enabling the digital transformation of care? Yes,
absolutely. I mean, I think we're very clear to say, as we did in the recommendation on the European Electronic Health Record Exchange that we adopted last year, how important it is that we work together with member states to make sure that the citizen feels at the centre of this digital transformation of health and care that we're developing. The way that we work here, first of all, I mean, personally in Connect, we have a large budget of Horizon projects where we're really looking at innovation around, the role that technology can play in putting the citizen at the centre. So, for example, we've had in the past some quite innovative projects, and I would encourage people to look at them. One of them called My Health, My Data, and it was about how can we use what kind of technology do we need, and how can it work that the citizen, that they, for example, not only have access to their data, but they can also feel the degree of consent in terms of how their data is being shared and used. So one thing that we're doing is getting, we feel strongly there's a role for technology here. There's obviously a role for governance frameworks here. And we see, for example, that the part of our work is about getting proofs of concept for what works. Sitting in DG Connect, we are surrounded by colleagues working on other kinds of technologies, and we're looking at these all the time for how they can be brought to bear on the health sector and how they can be used for the benefit of building a citizen-centered health and care system. We do bring citizens and patients, of course. European level, we have dialogue spaces with citizens and with patients. We have a European health stakeholder group, which includes patients and consumer organizations. We have regular consultations with patients and citizens at the European level. And of course, each of these representatives tend to be European representatives of patient groups who have themselves networks and then at the country level, and then are bringing up their experiences from being within a health system, a particular member state. So of course this is absolutely essential. I think at the end of the day, what we're trying to do has got to be a system that works for us, so that we can feel confident and assured that we are using our data, it's making us empowered, and that we feel confident in how our data is being used in society.
Thank you, Ceri. With everybody's permission, I am going to extend this broadcast by 5 minutes because there are so many questions now coming in, and I would like to give the panelists the opportunity to answer as many as possible. Päivi, this may be one for you, and then Stjepko. A question on how do you cope with local resistance from people to share data? We saw some countries where the COVID apps was a failure because people don't want to share their data. Now, Päivi, you said that you had success in that 40% of people immediately downloaded it, I think, within 2 weeks. So obviously there's less resistance in Finland. But how do you cope when there is resistance? And would you have any tips for other countries who are facing greater resistance in sharing data?
Open public discussion is very important. As I mentioned before, we are now preparing the genome law proposal, and we have been preparing that for some years now, and we have had public discussion going on. So I think that builds then trust. There is no other way than get then the trust from the population. And Finland has a long tradition that while we are and when we are preparing our legislation, we have an open dialogue and discussion, and then people also see that what kind of responses then those who have been participating the discussion and dialogue have been then said about the legislation we are preparing, and then of course the other one which is very important is that when you then launch solutions, that if they are good and people feel that they help, they are a big help for their everyday life, that helps also, and we have a lot of these kind of showcases in our country, that people have got digital public services and solutions which really help them, and they are eager to use them, also the new ones.
Yeah, you have to see the benefits and the impact, indeed. Stjepko, I was just wondering, in your field, do you face any resistance for people sharing data?
So that's not a crucial problem in Croatia. So data collection from the cancer registries, consolidation of the common databases from the clinical databases, defining centers of excellence and oncology network are our crucial focuses. So also cross-border data sharing is crucial because, again, we are very small countries with 4 million inhabitants. Our data, it's not enough to make adequate clinical decision. So that's not a problem. Of course, with the proper regulation.
Thank you very much, Stjepko, and thank you for answering our audience questions. And there are more that are coming in that we will share afterwards. But I would like to go now to Floris, who has been listening intently. There we are. We can see that he's been listening intently and illustrating and visualizing some of the comments that our speakers have been making. Floris, would you like to share with us now some of your drawings, and if you would like to make any comment about them, please do.
I'd be happy to, Claire. This is the first one. Can everybody hear me fine? Obviously, it's a no-brainer that happiness and mental health is a cornerstone of physical health. So I think it's a good idea to keep that in an index and to keep that index updated at all time, especially in these times. We have been talking about the need to share data across state lines and country lines, because obviously it's not a good idea to keep sensitive information that may save lives from people just because you can. Another important thing that was mentioned, I think, is the inoperability of data, inoperable data. I always get more ideas than I can process in such a session, but it's obviously quite a task to distinguish between things that are relevant, as these two struggling medical professionals demonstrate in the midst of a If I'm going too fast, please feel free to tackle me. I always get very excited when I'm talking about my work.
Two more cartoons, and then I'll just say, show us two more, Floris. And I will say that but don't worry, because what I'm offering you is that these cartoons are going to be on social media. They will be on the LinkedIn pages, the Facebook pages, and so people can really have a look at them. But yes, there we are. On the top of your index, what are your best two?
I would say this one I liked very much, the reliable data picture. A lot can go wrong in making a picture of someone, even if it's something as complicated as health and all the horrible things that can go wrong. Let me see. Sensitive data was another thing that really picked me. I can see that go to places where it shouldn't belong. Obviously, someone's genome should be their own.
Excellent. Floris, what I'm going to do is I'm going to ask the panelists for their last remarks in 30 seconds, and we'll come back to you with one last picture at the end. Okay.
All
but
right.
As I say to everybody, you can see the whole array and gallery of Floris's pictures on social media, and you can see how fast he works. So let me go back to the speakers. Päivi, 30 seconds, a nice tweet. We're now in the world of social media. What is your key message that you would like this audience to take away?
Ceri and EU and European countries keep on going the good work with trying to have a Europe where the data flows across the borders, and we are in an ecosystem where then the new technology is innovated and developed, because we here respect the rule of law and respect people's privacy.
Thank you. Stjepko.
So, taking into account everything that was said today, I would like to leave you with the message that we all need to devote all our efforts for personalized healthcare treatment solutions to become widely available for patients across different therapeutic areas, including activities related to the secondary prevention, such as genomic testing and early screening, which are at present not available in all European countries. This is crucial because such approach will result in improvement in treatment outcomes and will ensure equal treatment opportunities for all European citizens. We know that there is no two patients which are same. Personalized healthcare and decision-making based on data can reduce waste, free up much-needed resources, and improve patient outcomes. Again, cross-border data sharing is crucial. It allows countries to learn from each other, support evidence-based decision-making, reduces health inequities, and drives progress towards personalized healthcare.
Stjepko, thank you for your 3 tweets there. Ceri, do you have one tweet, a final message that you would like this audience to take away?
Yeah, I think that the conversation today has been very encompassing and has touched upon, the interests and perspectives of different kinds of groups, clinicians, governments, patients, citizens, innovators. So I think the point I want to make is that the digital transformation of health and care is really a societal project, and I think we all need to be involved. And so I would urge listening to think to themselves, what's the role of me or my organization, and perhaps to use tools like this index to start a conversation where they need to have it started to see how they can join the conversation and the effort going forward.
Well, Ceri, Päivi and Stjepko, thank you very much for joining this conversation to launch the Europe Personalised Health Index. There will be indexes launched early next year for Asia Pacific, for Latin America and Africa. But for our final thought, let's visualize it and go to Floris for his final cartoon.
The penultimate cartoon. I completely like the idea of the no two patients being the same. So obviously the one-size-fits-all approach is not resilient and can even endanger some people. So personalized healthcare, I think, is a no-brainer. And another thought I would like to share with you is the sharing aspect is obviously also a no-brainer. The more we democratize data, the better we can build a picture. One more picture. Let's see. I like the concept of checking in with your neighbor to see how you're doing, but I also can see that the more data you get, the more you get a complete picture, because there's always someone doing worse than you, and there's always someone doing better than you.
Well, I think that's a lovely message, actually, on checking in on our neighbours as we are all living very, very difficult times. So I would like to thank everybody for taking part, encourage you to go on the FutureProofing Healthcare Initiative website to get more information about this index and, of course, to see some of Floris's wonderful cartoons. Thank you very much for joining us.